I want to take a moment to shift a little bit and shift into the federal agencies and the broader policymaking landscape. Because understanding who has influence is just as important as understanding what needs to change and how you might do this. So there's a lot of different ways to approach this. Depending on what your cause is, there's different agencies that might play a role. In health advocacy, for example, much of the action happens within the Department of Health and Human Services, which oversees agencies like the National Institutes of Health, the Food and Drug Administration, the Centers for Disease Control and Prevention, and even the Centers for Medicare and Medicaid Services. So all of those agencies, while they stand alone, are part of an umbrella under the Department of Health and Human Services. So it is good to know who does what. They often work together, but they are independent and separate, and they have their own leadership. Even within those agencies, there's different offices and divisions to be aware of as you're thinking about sort of what it is that you want to get to. But these agencies shape everything from research priorities to product approvals to reimbursement policies. And so knowing what they're working on can help you understand where you want to engage. But it's also important to know that advocacy has shaped these agencies. So, for instance, back in the early 90s, at the Society for Women's Health Research, we were wondering why there was no point person or office that oversaw women's health or research into women's health. And so we were able to work both with the agencies. So some of these offices were stood up on their own within HHS, Department of Health and Human Services, within particular agencies like the FDA, NIH, and CDC. They all have offices of women's health now. But we were able to do that by working directly with them and advocating for it. And then I don't want to call it the back end, but the other side of it was to codify those offices into law so that, regardless of what was happening in administration priorities, because those do change. And, we're not talking about a lot of money here for these offices, but it is very important and critical to women's health and women's health research. We codified those offices to make sure that they would continue on. So the Office of Research on Women's Health, which is at NIH, that actually was codified. It was created in 1990, or established rather, and then codified and signed into law in 1993 as part of the Revitalization Act. The other offices of women's health were codified into law in 2010 under the Affordable Care Act. So very important here that we understand that you can advocate at both of those levels. It's not just congressional action that might get you where you want to be. Sometimes working with the agencies directly is a way to go. So since we've done all of that, we've had a lot of opportunity, I think, to interact and engage and really make the case for women's health and women's health research. But we also need to look at the congressional side. And there's several key committees that are responsible for developing and overseeing legislation related to health policy or public health and biomedical research. And some of the most influential include, and maybe this is a sign of my bias here, on the funding side, the appropriations committees. The House and Senate both have appropriations committees. Their subcommittees related to labor, health and human services, and education are the subcommittees that we like to look at to advocate for increased or focused funding for women's health research. So that's where we at SWHR and a lot of our partners are advocating every year. That's an annual process, and there's an opportunity to send letters, sign on to letters, sometimes testify in front of Congress on that, bring others with us to do that. And so we want to make sure we're doing that every year. There are other committees that are known as authorizing committees. Those are authorizing programs. And I'm sure we could do a whole webinar talking about the differences between authorizing and appropriating. And likewise, we could, and maybe Erica, we can enlist you in the future on some of this, really thinking about how you want to make sure that what the difference between mandatory and discretionary spending is. That's really super wonky at this moment. You just need to know that there are committees that fund the programs that we advocate for, and there are committees that create or authorize the programs that we care about. Sometimes they will fund, sometimes they don't. You have to use a separate path. But the committees that authorize on the Senate side are the Senate Committee on Health, Education, Labor, and Pensions, and the Senate Finance Committee. I know finance does not sound like it does anything in healthcare, but they oversee Medicare and Medicaid and children's health insurance program. And so they have a really key role in healthcare policy because at the end of the day, healthcare policy has a lot to do with finances and spending. On the House side, there are really two committees of jurisdiction that we look at pretty closely. The House Energy and Commerce Committee, which looks at healthcare policy, Medicaid, Medicare, and public health preparedness, and the Committee on Ways and Means, which also you initially would probably think, oh gosh, that's probably just tax or trade. It includes a subcommittee on health, and they look at Medicare policy specifically. So it's really important on that financing side to make sure that you understand if there's a particular piece of legislation that you're following, what committee is it going through, who sits on that committee. Does a person who sits on that committee happen to be your member of Congress? Even better. So lots of different ways to think about it, but just a basic level of understanding of that, not necessarily the process. It can help influence how your issue gets heard, how you might want to target your advocacy and ensure that your message reaches the people who have the authority to act on it.